Now we move on to third section of our lecture, and in this section we will talk about malignant diseases of vagina. In this section, we will talk about the epidemiology, etiology, and pathology of vaginal malignancy or carcinomas. We will talk about the clinical presentations and diagnosis, and also the staging, prognosis, and treatment, and also we will talk about clear cell adenocarcinoma. So what's the epidemiology and etiology? It's a rare cancer, it's not very common, and it is usually arise as a result of metastasis from endometrium and cervix. So primary cancer of the vagina is not very common. It occurs as a result of metastasis or spread from the endometrial or cervical malignancies. 1 to 2% of gynecological malignancies include the vaginal malignancies. The age at the presentation or onset is about 60 to 70 years of the age. So patients who have the vaginal malignancy usually are post-menopausal and they are in the late age. Sarcoma botryoides is also one of the cause. HPV infection. The risk factors for the vaginal carcinoma, there is malignant or premalignant disease of the cervix, vaginal intraepithelial neoplasia that can lead to vaginal carcinoma, pre-malignancy disease with risk of progression to invasive disease, if there is history of pelvic cancer or if there is HPV infection. All these are the risk factors for vaginal malignancy. Pathology, this is the microscopic appearance of the vaginal carcinoma. Sites are usually the upper third or the posterior wall. Upper third or posterior wall is the common site for the vaginal malignancy. The naked eye is usually a naked eye appearance of the malignancy can be ulcerative or it can be fungative type. Histopathology is squamous cell carcinoma. This is the histopathology, squamous cell carcinoma. Clinical presentation and diagnosis. In this diagram, you can see this is the cancer of the vagina, growth inside the vagina. And how the patient will present, usually as with any other malignancy of pelvic origin, usually the patient present with abnormal bleeding and blood stain with vaginal discharge. So blood stain vaginal discharge, if there is not frank bleeding, and then usually the bloody discharge is common. Speculum examination, there is mass or ulcer, and there is hematuria, blood in the urine, pelvic pain or tenesmus, feeling of incomplete emptying of rectum as a result of growth and pressure on the rectum. Patient will feel like there is incomplete evacuation of the rectum. Diagnosis of vaginal malignancy is usually, as with any other malignancy, biopsy is important. And then staging according to International Federation of Obstetrics and Gynecology, cystoscopy and sigmoidoscopy, MRI, CT scan of thorax and abdomen. Next staging, in stage 1, there is tumor which is limited to vagina. 5-year survival is 75%. In stage 2, tumor invades to the subvaginal or below the vagina tissue, is 40% survival. In stage 3, tumor invades pelvic side walls, and now the survival is 30%. And stage 4, tumor involves the bladder or bowel mucosa and extend beyond the pelvis. That's about 0 to 20%, 5-year survival. So all this is staging, stage 1 to 4, depending on the whether the tumor is confined to vagina or it spreads beyond the vagina into the surrounding organs. The treatment for the vaginal carcinoma is radiotherapy or surgery. And then stage 1, usually the growth is limited to upper third and growth limited to lower third. Stage 2 to 4, pelvic exenteration operation. So radiotherapy or surgery in stage 1. In stage 2 to 4, usually pelvic exenteration operation. It's a little extensive operation in which the surrounding tissues and areas are removed. Here, if you see in this diagram, this is the cancerous tissue in the vagina, in the upper part, limited. Now it's slowly spreading. Now it's extending more and more. So outside the cervix. Radiotherapy is also used even for stage 2 and 4. Then what's the clear cell adenocarcinoma? As the name shows, it's the carcinoma in the glandular tissue, clear cell. In the microscopic appearance, histological picture, you see the glandular tissue also. So it's the clear cell adenocarcinoma. Adolescent girls who have had a history of intrauterine exposure to DES, diethylstilbestrol, in the first trimester of pregnancy. Usually these girls get this type of carcinoma as a result of diethylstilbestrol is used as an abortifacient. Young girls who don't want to have the pregnancy, they want to abort it, and they use diethylstilbestrol. This can cause clear cell adenocarcinoma. So that was all about section 3, in which we talk about the malignancy of the vagina. Thank you for watching sqadia.com.